PSA is probably the most misunderstood blood test in men's health. PSA is not a cancer-specific test, but a prostate activity mark due to other conditions like urine infection, inflammation of the prostate called prostatitis, recent catheter insertion, PSA test guide. PSA is probably the most misunderstood blood test in men's health. In reality, more men are getting PSA tests than ever before. Sometimes during routine health checks, sometimes because of urinary symptoms, and sometimes without knowing why the test was ordered. So I regularly meet patients who walk in extremely anxious, holding a report with slightly elevated PSA, convinced that they have cancer. So in this video, I'll explain what PSA really measures, what has changed in how we interpret PSA, why a single number is rarely meaningful, and how modern evaluation helps us avoid unnecessary biopsies while still detecting cancer early when it truly matters. So if you are watching this because you or someone you care is struggling with this problem, you are at the right place. So I regularly create detailed videos on common urology topics. So consider subscribing so as not to miss any future updates. Coming back to our topic. What PSA actually is. So PSA stands for prostate specific antigen. It is a protein produced by prostate tissue, both normal and abnormal. PSA is not a cancer-specific test, but a prostate activity mark. So any condition that increase prostate activity, irritation, or volume can raise PSA levels. This is the most important concept patient must understand before reacting to PSA numbers. Common reasons PSA rises. PSA can rise for many non-cancerous reasons. The most common cause is benign prostatic enlargement, which is very common after the age of 50. PSA also rises due to other conditions like urine infection, inflammation of the prostate called prostatitis, recent catheter insertion, recent ejaculation, cycling or perineal pressure, or even constipation in some cases. Cancer is only one possible cause, and statistically speaking, not the most common cause. PSA values and age. One of the biggest mistakes is treating PSA as a universal number. A PSA of 4 is very different in a 45-year-old man compared to a 75-year-old man. PSA in context. In context to what? In context to age, prostate size, symptoms, the PSA trend over time. There is no single safe or a dangerous PSA number for everyone. Talking about PSA trend, density and velocity. Modern PSA interpretation focus on patterns and not panic. PSA trend means whether PSA is stable, slowly rising or rapidly rising. PSA density compares PSA level with the prostate size, while the PSA velocity measures how fast the PSA is increasing over time. These parameters help us identify which patients need further testing and which do not. Stable PSA is often reassuring, even if the number is slightly high. Now, what is the role of MRI before biopsy? One of the biggest changes in prostate care in recent years is the use of prostate MRI before biopsy. Biopsy is no longer the first step for many patients. PSA is concerning, MRI is often done first, and MRI helps us identify the suspicious area, avoid unnecessary biopsies, and perform targeted biopsies when needed. This approach reduces complication and overdiagnosis. When should PSA make you worry? PSA deserves attention and not fear. We become concerned when the PSA keeps rising consistently, the PSA density is high, or MRI shows suspicious lesions and the family history is present. Even then, the next step is evaluation and not the immediate treatment. Many patients are monitored safely without intervention in early stages. Now, there are some common PSA myths that can cause panic. There are several dangerous myths around the PSA. Myth number 1, high PSA equals cancer. False. Myth 2, biopsy is inevitable. It's not anymore. Myth number 3, normal PSA means no cancer. This is also false. PSA is a screening tool, not a guarantee. So understanding these myths prevents unnecessary anxiety. The question is, should PSA be done for every man? PSA testing should be individualized. It is commonly advised after the age of 50, earlier if there is a family history, or when the urinary symptoms are present. Blind testing without counseling often causes confusion. PSA should always be ordered with a plan for interpretation. Now, what's the take-home message? PSA is a guide, not a verdict. We use PSA intelligently alongside imaging and clinical judgment. A single number should never define your future. Also, proper interpretation protects patients from both missed cancer and unnecessary procedures. If you understand PSA, you replace your fear with clarity, and that is a good medicine. If this video helped you, share it with someone who may benefit, because correct information reduces fear. And thanks for watching.